The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
It's been a no good, very bad year for kids just trying to grow up in some kind of normal. Tonight, how that's affecting kids' mental health and what to do about it. Also, after months of lockdown and tough times, we'll get some insight on how to find respite from what often feels like being surrounded in grief. It's Thursday, May the 6th, and that's ahead on the agenda. For kids, this pandemic has meant disruption from top to bottom. Nothing as usual. Not sports, school, activities, time with grandparents, no birthday parties, and that's amidst families that are stressed as never before. How well are children and youth coping? Let's find out. We're going to ask in London, Ontario, Dr. Javid Sukkara, Associate Professor of Psychiatry and Pediatrics at the Schulich School of Medicine and Dentistry at Western University. He's also a past president of the Ontario Psychiatric Association. In Mississauga, Ontario, Catherine Hay, President and CEO of the Kids Help Phone. And in the West End of the provincial capital, Sherry Terrell, clinical psychologist and psychoanalyst at Life in Balance Therapy and author of the Mindfulness and Acceptance Workbook for Teen Anxiety. And we're glad to have you three on TVO tonight to discuss something that sadly is very timely and important. We're going to start with some information from a Sick Kids Hospital-led survey. This is a survey of parents and youth from last spring. The study found children and youth experienced relatively similar overall mental health impacts, no matter their clinical history. However, those with autism spectrum disorder, ASD, reported the greatest deterioration in depression, irritability, attention span, and hyperactivity. Having a pre-existing psychiatric or neurodevelopmental diagnosis was associated with both improvements and deterioration in mental health. One concerning finding for the study team was the significant proportion of otherwise healthy school-age children who experienced deterioration in a number of mental health domains, including depression, anxiety, irritability, and attention span. Okay, lots to dive into there. Javid, get us started. What's your greatest concern about what's on that list?
I think my greatest concern is that there are a large number of young people who have significant functionally limiting symptoms that were having a hard time getting access to help before the pandemic. And clearly we know that in the context of a chronic stressor of the nature that we're all experiencing, people's mental health is going to deteriorate. So my biggest fear is that there are many people who are going to build up the courage to ask for help, and that we won't have the infrastructure to be able to meet that need, leading to prolonged waiting lists, problems with access, and ultimately worsening mental health for a lot of young Ontarians.
Kathy, to you next. I'm assuming some of the kids that have been reaching out to the Kids Help Phone for advice and assurance, well, I'm assuming those numbers have gone way up in the past year. Is that in fact the case?
That is in fact the case. And I do agree with Javid that there was a problem before COVID hit, and lay COVID on top, and it has been an extraordinarily hard year. Our volumes have gone up about 140% across Canada to 4.6 million interactions with young people. And the acuity is high, their isolation fear, it is all growing. I could not agree more with the Kids Help Phone or the Sick Kids study.
4.6 million interactions. Just explain what that means, if you would.
That is in every province and territory, 4.6 million times someone reached out to Kids Help Phone through any one of our service modalities. Mostly we will see it through self-help and self-directed tools, but right through to our professional counseling and our crisis responders.
And one more follow-up. I assume it's not only kids who are calling. I presume parents are calling as well?
Yeah, well, our typical day at Kids Help Phone is 5 to 26 is a typical day, but we also have parents, adults at 2 in the morning. Quite frankly, we are the only 24/7 mental health solution in the country.
Sherry, it's been widely reported that young people today experience higher levels of depression and anxiety than previous generations. How has what they've experienced this past year added to that already established problem?
I think what I'm seeing in my practice is some of my patients were relieved at the beginning of COVID, much like the sick kids study reported. The social pressure was off. But in the last couple of months in particular, even those kids are not faring so well. And I'm getting a lot of new referrals for people who've never experienced any mental health struggles, many of whom are calling the kids' help phone as well. But I agree, I think what I'm seeing the most of that is really heartbreaking is the lack of hope. And the kids are really losing hope. They can't focus, they don't see a future, and it's just absolutely heartbreaking. And I think they're under a lot of pressure. This generation always has been. It's not new, as Kathy alluded to. But I think they're told as young as grade 7 by their peers, by their schools, their families, and the world around them, you've got to get good marks to get into a really good high school and a really good university. And it has to be a prestigious one, not just any one, so that you can get a really good job and make a lot of money. And the pressure's there. And then they have to solve the world's problems while they're at it. And this
I
is
would
just
love
all
to
making
disabuse.
it worse.
Yeah, forgive me. I would love to disabuse people of the notion right now that everybody's got to go to Harvard or Yale or their life is going to turn out to be a disaster. That's just, on the face of it, ridiculous. But
Yeah.
okay, Javid, more than a year into this, what do you think has been the most damaging risk for kids, both now and in the long term?
The most damaging thing is really hard to distill, because I think this is like a complex chronic stressor that not just kids, but we're all experiencing collectively as adults. And in the context of that, what I've seen and heard with the young people that I work with really are two main concerns. The first is how this has affected learning. Now, there's no one size fits all. Everybody's different. Some people are actually thriving and doing okay. So we have to resist overgeneralization. But there are many young people who are really struggling with distance learning. They lack the kinds of individual supports that they need, particularly young people who might struggle with attention or learning difficulties already. And that's leading to further deterioration in their mental health. The other group are people who struggle with situations where there's high degrees of conflict in their home and they're feeling stuck. They're feeling like they don't have an outlet. And many of these young people, like was said earlier, are struggling with hope. And that's really what keeps me up at night, is that sense of dread and hopelessness, which is important for us as adults to help counter by sharing hope and spreading hope wherever we can.
Sherry, can I just follow up with you, because you mentioned hope as well. Is the loss of hope related to they think this pandemic's never going to end, or what is it?
I think it's probably quite multifactored. I think it is the idea that it's not going to end. The end doesn't seem to be in sight anytime soon. And I think it's just what others have mentioned around the loss of their peer group, their social supports, their extracurriculars. And I'm still hearing from many that the expectations aren't changing. They're still expected to do well at school, get their A's, attend class. And I think there's a real imbalance between what they're going through and how they're functioning and what's being expected.
Well, we should still, I should ask, I shouldn't assume. Should we not still expect kids to get good marks?
I think we can hope that they will. And I think when the moment's right, we can expect them to. Yet I think it just feeds into that pressure that I was speaking about a few minutes ago. Many of the kids I work with and that I'm hearing about from colleagues, they're happy if they get out of bed in the morning and eat breakfast. That at this point, especially in the late end, the end of the school year, they're completely exhausted. They have no enlivenment, no fulfillment. There's no spontaneity in their day. They are just dreading every minute of their day. So I do think that we have to listen to them and we have to dig into their experience and what they're going through. And I do think the expectations have to settle down a little. I think we've got to take our foot off the gas pedal.
Now, Kathy, I don't know how to ask this well, so I'm just going to ask it, and it will be inelegantly asked, but you'll get the drift of what I'm talking about here. Of course, the kids that the three of you are dealing with are having among the toughest times in the country. Do you think they are reflective of the entire, say, under 18 population right now?
It's a great question. And we are speaking to kids in every province and territory. So I do agree that the sense of hopelessness, isolation, fear, there is a lot of fear we're hearing from kids across Canada right now, afraid for their own health, for their families, for well-being. I also agree that the isolation is creating different dynamics within the home, and the expectation day to day is really stressing our kids out, and we hear it every single day on our platform. So, answering to your question, this is a national crisis that we are seeing, and I also want to make sure we remember that what we're going through now, and I do see a lot of hope actually from the young people that reach out. And the hope I see is that they are reaching out, that they are learning help seeking behaviors, and they continue to do so. That is a really good resiliency coping mechanism that we are seeing at Kids Help Phone. What we worry about is the trauma that is coming from this past year. And let's remember, it's not just COVID, and it sounds weird to talk about just COVID because it's been pretty traumatic. But in there has been the shootings in Nova Scotia. There's been huge unrest around social injustice, and we saw major spikes on our platform around the murder of George Floyd and all the issues around social justice. So I am incredibly worried about this year, next year, the year after, and if we forget this trauma as a country and as a government, we will have let our kids down.
It is a lot to deal with, isn't it, for young people? They've got the healthcare crisis we're in the midst of, an economic crisis for many families, of course, who've either lost jobs or seen their lives turned upside down. And then the social justice reckoning that is happening, that's a triple whammy for a lot of families to deal with all at the same time. Javid, we know the wait list for mental health services before the pandemic hit was already plenty high. Is there anything more beyond, obviously, I mean, I guess doubling funding would solve a lot of problems, but anything beyond that you could recommend right now that would bring more capacity online?
Well, I think you said the most important thing. We've got a persistently and intentionally underfunded system. It's continued to be underfunded despite successive governments, despite attention to the issue. So we need to do that. We also need to recognize that there's a distinction between people who are struggling with a normal emotional response to a stressor that are seeking help and support, and people who have more of that functional debilitation, who need a higher level of treatment, who need evidence-based health professionals who are trained to be able to support them. So what goes hand in hand with funding is people. We've got a mental health workforce in Ontario that's extremely stretched. There's only about 100 college registered child and adolescent psychiatrists in the entire province. It's the same group of us that have been stretched more and more over the past decade. And I'm really concerned that there's a lack of health human resource planning, which is holding things back.
In which case, let me get your take on the announcement that the Ontario government made just this week, $80 million for mental health supports in the school system, 1,000 more mental health workers over the next couple of years. How would you characterize that?
I think it's promising. I won't say that it's a bad thing, but it's simply not enough. School mental health workers don't typically provide treatment. They can provide support, they can provide counseling, but we see most of the cases where there's significant clinical presentations presenting to mental health professionals who will continue to have waiting lists. I don't think that money is going to make a dent in the sort of atrocious fact that some young people are waiting 12 to 24 months for evidence-based treatment. So, it's encouraging that they're spending that money, but I would wish that governments would do less politically popular sprinkling of funds and do more sustainable annual operational investment in children's mental health so that kids don't have to wait.
Let me do one more follow-up with you, because I suspect some people watching this are not going to know the difference between a sort of politically nice sprinkling of funds versus what it is that you're actually looking for that's meaningful. Can you give me an example of the former and the latter?
Absolutely. So, the politically convenient thing to do is to sprinkle funds, into a unit here or a program there or a sector there, to have a photo op and to issue a press release. That's great. But what that doesn't address is the fact that people across Ontario are waiting up to 12 to 24 months for evidence-based care. And sustainable funding would mean sustainable dollars to community children's mental health agencies to invest in human resources to pay salaries for people to be able to provide the treatment.
Now, Kathy, did I see right, or was it my imagination that you did an announcement with a couple of cabinet ministers this past week?
Yes, you did see that right. Kids Help Phone has received good funding from Ontario this year to support the exponential growth that we have seen. I will agree that the ecosystem itself cannot be funded in pockets. So it's fantastic that young people can reach Kids Help Phone 24/7, and our wait is 3 to 4 minutes. And young person in suicide ideation, it's 40 seconds before we get to them. But that is a single session in a moment in time, and that is our job at Kids Help Phone as part of the ecosystem. For some young person to wait 12 to 14 months for evidence-based care is too long, and Kids Help Phone cannot sustain a young person for 12 to 14 months while they wait.
Kathy, I don't know if this is knowable, but do you have any idea how many kids you've talked down off the ledge, so to speak?
Mm-hmm. So about 20% of the work we do every single day is around suicide, ideation, self-harm in significant ways. That's every single day. And every single day we do between 10 to 15 active rescues, active suicide rescues, where there is intent, a plan, a means to end your life. And we do that every single day. So in 2020, we conducted more than 43, almost 4,300 active suicide rescues. That's in addition to the 20% of work we're doing, speaking to young people, building safety plans, getting them through to a good referral source. So yeah, it is a crisis in this country. And dare I also speak about Indigenous youth and Black youth who are really, really suffering through this pandemic, more so and in more acute ways. You're seeing that on our platform.
I want to make sure I heard you right there. You saved more than 4,000 kids from killing themselves last year.
Correct. That is correct.
Okay. And the money that you just got from Queen's Park this past week, how far will that go to helping you fulfill your mission?
So I am grateful for any funding we can get. It will help us to pay some salaries, make sure our service is 24/7. We rely on other funding though, so it will not close the full gap. Thank goodness we have other funding.
Sherry, let me ask you, is there any particular tool or technique that you apply when you are dealing with a young person challenged with anxiety or depression?
Oh, that's a big question that I could take all week to answer, but I'll try to distill it down. I do work mostly from a modality called acceptance and commitment therapy, or ACT. And rather than seeing it as a skill set, sort of here's a hammer, I'll teach you how to use it. It's really about teaching people how to have their thoughts and feelings, because I think there is a lot of pressure in the world that if you don't like your thoughts and feelings, you need to fix them, get rid of them, or shut them down, and you need to be happy. And humans are not happy all the time. So with ACT, the emphasis is really on how do you live with yourself and your inner self, your thoughts, your memories. How do you have a different relationship with that? And it's a lifelong practice and a lifelong way of being. The emphasis then becomes on who do you want to be, who's the person that matters to you, and who and what matters to you in your world, and working with people to help them really go in that direction, which with young adolescents and young adults is really wonderful because they're right at the age where they're looking for identity and meaning in life. And it's less about the outcome and more about the journey. So I find it really helpful to work with kids, teens and adults and parents around being able to have thoughts and feelings and not try to fix them and get rid of them.
Have you got a ballpark figure as to how many kids in a typical year you might help through the course of your work?
Not as many as I'd like, because I do a lot of individual therapy and see about 40 people a week. I think about 80% are teens. We have started to do a lot more online groups, and we're trying to get some workshops in place that could be offered Canada-wide so that we can reach people who don't have a lot of money, who can't come to therapy every week, so that we could do it more as a skills-based teaching. So we're working on it, but certainly not as much as I would like. And people
How,
aren't leaving therapy.
right. How
There's a
much,
real backlog now.
how much of the work that you do involves actually convincing parents in the first place that children need your help?
For me, not much, because they're reaching out to me. So it's kind of a built-in. I think the harder part is for me to convince parents that they might need some help. Because I think often when there's a highly anxious or depressed or inattentive teen, or just a teen who's struggling, parents are probably struggling too. And it's really hard to watch your child suffer. So I find more often than not, I'm also referring parents to places and trying to find them therapists that can help support them so they can support their teen.
Kathy, you got a ballpark as to how many people you've got working under your roof helping people out?
Well, that's a great question. At Kids Help Phone, we have about 192 clinicians on our phone and chat, and those are professional counselors for single session counseling. We also have an incredible technology in our texting platform, which enables us to train and support crisis responders, their volunteers. We have over 4,000 volunteers that support kids through texting, and that is on AI machine learning technology with professional counseling, an additional 60 or 70 people, professional counselors that oversee conversations in real time. So if it triages, and we triage based on acuity, not first come, first serve. If it triages with a suicide ideation or high issues, a professional counselor is right there. Again, with 3
Kathy,
minutes.
I always like to ask the helpers, because the helpers need help too from time to time, and particularly when they are, all day long dealing with some of the unhappiest and most anxious people in the country. How do you ensure that your helpers get help?
I thank you for that question, because our helpers, our counselors, they are the virtual front line. Sometimes they are the only front door a young person could go through with whatever their issues are. So our counselors, they're all remote now. They used to be in counseling centers where they had each other and debriefing moments and counseling managers to counsel them. They're in their bedrooms sometimes, starting work, and their first call could be a suicide or a mandatory report for abuse. The barriers are just so blurred right now for them. So we do a ton of self-care time. We make sure we reduce the number of calls or chats they take in any given day. We actually have paid sick time for our people as well, which we're really proud about. And we're just going to support them however they need, because they're supporting kids in this country.
Javid, I've asked this question of numerous doctors and nurses, so I'm going to ask you as well. What constitutes a good day in your life? Because I can imagine, if you're a doctor attending to people who are dying, or a nurse attending to people who are dying in your ICU all the time from COVID-19, that's a hard thing to deal with day in and day out. So what constitutes a good day for you?
It's such a tricky question for me right now, because I can tell you that the level of grief, the level of emotional energy that I would say I've and many mental health workers have had to invest this year has been unprecedented. And you add on that the isolation of not having a peer group that can be a support. So I've talked to many who've struggled, but your question was, what's a good day? And I would say I try to think of every day as a good day. I see it as a gift to be able to work with young people who continue to inspire me every day I work with them. A good day for me in the last 2 weeks was a young person whose life goal was to buy a house, telling me that they were approved for a mortgage, or a young person who struggled many months ago, who's finding that they're thriving in part-time employment and have set goals on something that they see as achievable. So it's really, to me, the energy, the enthusiasm, and the light and love that young people bring that makes a good day for me.
And what's the ratio between good days and bad days?
Well, you're challenging my framing there, Steve. So I'd say 100% good days. However, it's been really tough. I think when we're locked down, adults struggle too. And I can tell you, I have young ones at home. I have young ones who have their needs. So if their internet isn't working in the middle of a science test, and I'm fully present or trying to be fully present for a young person I'm trying to support, that can be tricky. The other challenge I find for many people is that because there's only so many of us and the demands are going up, there's a kind of moral distress that happens when you're, an intake worker, for example, and you have to tell a parent who's got a child who needs help that they're going to have to wait. And that takes a toll. And this year, it feels as though that toll just keeps accumulating and accumulating over the year. And I'm really concerned about what that experience is going to be like in the wake of all this for the people who are working day to day in mental health.
In which case, let me ask you the same question I asked Kathy. Who helps the helpers?
Well, I think we have learned to help ourselves, but we're really bad at that. People who work in mental health also struggle with, stigma around asking for help. Even though we cultivate hope in others, we sometimes don't practice the best care for ourselves. So, in terms of the help of the helpers, I think we need people who might be employers who are supportive, like Kids Help Phone, for example. But what we also need is a government that recognizes the work that we do, that honors the work that we do, and that invests in it, that listens to what mental health workers are saying, that listens to what young people are saying, and really promotes a narrative that shows that we can move forward in a way that meets that need.
Okay, you're going to forgive me this extra follow-up now because you just raised something that I can't let go. You said we need a government that ... Do we have that right now?
Frankly, no. Frankly, no, we don't. I'm going to say this very candidly. It's great to sprinkle money here or there, but this government has been in power for several years. They have not yet provided a sustained investment in children's mental health. We know that the return on investment is clear. A dollar invested in early intervention will save many dollars down the line. And what we've seen thus far from this government is sprinkling of funds here and there, no sustained investments. Every year before the budget, children's mental health agencies make it clear that $150 million a year can reduce wait lists to within 30 days. And that's not recommendations that the government has acted upon. And they simply haven't been listening. And those of us who work in the system and the young people and the caregivers that we serve, we've been shouting at the top of our lungs for years, and we haven't seen that sustained investment.
And to be clear, you're talking about the government of Ontario.
Yes, I would say the government of Ontario has not been listening successfully to the needs of children and youth who are struggling with mental health challenges.
Okay, in our remaining moments here, I do want to come back to the issue of hope. And Sherry, let me raise that with you, because yesterday Health Canada did announce that they're going to recommend the Pfizer vaccine for kids as young as 12. And I wonder whether you think that might change the equation when it comes to hope for people of that age.
I hope so. I think it's going to depend, and that's my favorite answer for many things, on when it happens, and hopefully the optics won't be so chaotic. I think getting the vaccine out is a whole other issue. But I do hope that, once the vaccine is out, that is going to give them some degree of hope. But I think there's a lot of other issues, even, wearing masks and who's wearing them, who's not. A lot of people are telling me they don't feel safe because they don't know who they're walking past. They're not wearing masks, and we don't know everybody's story when we're walking past someone on the street, standing in line with them. And kids are feeling ostracized if their friends aren't following precautions and they have to. So I think it may help. I'm just not sure the overall impact with a lot of the other stuff going on systemically.
Okay,
they need
Sherry?
to see that their entire world can keep them safe.
Sure. How about some advice for parents right now? We heard you refer earlier to the fact that maybe now is not the time to be pushing kids to get straight A's in all their classes. Okay, a little bit more advice for parents as they navigate the next few months.
I think for parents and teens, really take our feet off the gas pedal, slow it down, make things more reasonable, and talk to your teens. They don't have their friends and their teachers and anyone at school or sports to just spontaneously talk to. And never underestimate how important you are to your child. So talk to them, but more than that actually is listen to them. Get curious about them beyond just their role as a student, because there's so much more than that. And don't try to fix it. Don't try to reassure them, at least not right away. Don't try to compare it to anything else. Just listen and kind of get into the tough feelings with them. Just give them a lot of empathy. And for parents too, you know, a lot of self-compassion and kindness goes a long way. This is hard.
Kathy, last minute to you on that. A lot of kids are not communicative, particularly with their parents. So how should parents handle that?
Yeah, it's a great question. And here's the reality as a survivor of the teen years with 2 adult kids myself. And this is true. Kids aren't, it doesn't matter how wonderful you are as a parent. Kids aren't going to tell you everything. There's things that they just aren't going to tell you. And I think that's okay. And what we see at Kids Help Phone is about 56% of the kids that speak to us, they say 56% tell us something they would not have told somebody else. So I think just relax about the fact that your kids may not tell you everything. Make sure that they have avenues to tell somebody something. Make sure they have Kids Help Phone. That is a plug for our service. But if I could also put a big banner of hope out there for us all, and if we look to young people for that hope, there is an enormous amount of resilience in our kids. And we see that every day. And we talked earlier about 4,200 active rescues. Here's the hope side of that horrific statistic, is that those kids are the ones that picked up the phone and called us. So I think that is a beacon of hope. And we should follow the lead of our kids and reach out, if we as adults also.
Amen to that. Kathy Hay from the Kids Help Phone, Javid Sakara from Western University, Sherry Terrell, Life in Balance Therapy. Thanks to the three of you for sharing so much good wisdom with us and our viewers and listeners tonight here on TVO. Take good care, everyone.
Thank you.
Thank you.
You too.
Be well.
Too many people have lost loved ones during this pandemic, and truthfully, everyone has lost something, even if it's just some of the joys of everyday life. In big and small ways, grief has defined this past year. With us now for some help finding the way past all of that, in the west end of the provincial capital, we welcome Lisa Robinson, registered social worker and grief counselor at Andrea Warnick Consulting, and in the downtown core, Bailey Parnell, founder and researcher at the social media research organization Safe Social. It's good to have both of you on TVO tonight, and let's dive in with this. You know, social media is not necessarily the most pleasant place, even on the best of days, and we haven't had the best of days over the last year and more. So, Bailey, start us off. How has the pandemic exacerbated the amount of bad news that we are consuming on social media?
Well, I think you've actually just answered it there right in the question, which is that it has completely exacerbated the amount of bad news we're seeing, because before the pandemic, we were still seeing, an overconsumption of negative or hurtful or traumatic news on the news. But the pandemic suddenly made everybody feel like I have to be online, like I have to be consuming this, or I might be missing something that is huge in the global narrative right now. And maybe unsurprising to both of you, when the pandemic first hit, Safe Social started getting messages from around the world people saying to us, I just can't seem to put it down. And so the pandemic, paired with all of the sort of residual traumatic imagery and sort of happenings that have happened because of that, such as the rise in mental health issues and the sort of civil concerns and the justice issues that have all been combining to just overwhelm people completely on social media right now.
Yeah, Lisa, you can sort of understand the FOMO, as the kids call it, right? The fear of missing out,
Right.
because in addition to all the bad stuff, epidemiologists are all over social media as well. There's the opportunity actually to get some good information from social media. But of course, you got to wade through a lot of the crap before you can get to the good stuff. How difficult is that on most days?
I think it's very difficult to go through all of that. And I think there's a really significant impact on how we're all doing. And I come from a grief lens, obviously. And so grief itself plays a really big role in this. And Bailey made a really good point. We're trying to consume as much as possible, and we don't want to lose any of the information. And I think we have this false narrative in our head that if we have all of the information, then we can be more in control in tough situations. And being in control equals feeling safe as a human being. And that is not the truth. We consume all of this information and we're still left feeling heavier and more distressed and being faced with grief story after grief story through that.
Well, let's take a look at an example of something we're talking about here. This is, and of course, we do need a break from this every now and then. And here's a tweet from a journalist named Karen K. Ho, who had this to say. Hi, are you doom scrolling? A lot of heated debates and arguments on this website today. How about taking a hot shower and going to bed early tonight? Taking care of yourself always makes you feel better and helps give you more energy to tackle tomorrow's challenges. That sounds like excellent advice, but there's a word I hadn't seen before. Bailey, what's doom scrolling?
Yeah, doom scrolling has definitely been more part of the vernacular in the last year, and I think that's because people are encountering it for the first time. And what doom scrolling is essentially the overconsumption of negative news, hurtful news, traumatic news, or the doom of the world on social media. And the scrolling part is feeling like you can't stop, like you have to keep consuming this bad news. And there's a lot of reasons for it that I'm sure Lisa and I both encountered in our work in the last year, but it's definitely on the rise. And I think just defining it for people like we're doing here helps them to at least give them the language to explain their own experiences.
Lisa, why don't you pick up on that? If we know it's not good for us, why do we do it?
Yeah, I think similar to what I said earlier, that we want to feel in control. Everything feels out of control. We are living in a world that is very new. Things are changing constantly. We are watching people's lives fall apart, and then also dealing with our own personal, whatever your experience has been in the pandemic. And so we're grasping for straws as far as what makes us feel in control and how can we better understand this. And I think as we doom scroll, we feel like if I get more information, if I can understand this more, then I can feel better about this. I can feel safer. And I think often we're just looking for some sense of safety or stability. And in a pandemic world, that is really hard to find right now. So we continue to sit there and go through and think that will fill that need. But there's a disconnect there.
Yeah, Bailey, I'm sure we all know people who are, never mind they missed a birthday last year, they missed an anniversary, they missed an event of significance, a wedding, a graduation, or whatever. They're now coming up on year 2 of that. They are now missing 2 birthdays, 2 wedding anniversaries, 2 graduations, whatever. How is the tendency to grieve these losses online, in your judgment, affecting all of our collective mental health?
Well, Steve, I can actually say that I'm a part of that group on more than one front. I had to postpone my wedding in December 2020 to December 2021. Just a few weeks ago, we postponed it indefinitely, not really knowing when this is going to happen. Not the marriage, but the wedding. And then also in sadder news, actually, in just a couple of months ago, we lost my mom to cancer, and it was really hard, and we weren't able to have any kind of memorial or funeral. And honestly, it's still right now, as I'm talking to you, feels like an open wound, like we haven't really been able to close the sort of book on in a weird way. And so I'm really feeling from first person experience what everyone is going through. And I think that coming up on the second year of all of this, everyone really now more than ever needs to understand the risks of using social media and how this can either contribute to it, or if we need to take a break, it can maybe help our mental health a little bit. And when I lost my mom, because I know what we're talking about here today, I knew right away I'm not going on social media. I need a week off of social media because I don't know what I'm going to see there. It is a risk every time I log on that I'm going to be re-traumatized from something in the past. That in that week that I'm going to see even more photos of her, even more stories of her. And so I knew I just need a break. And at the very same time, I was getting all of these messages from all of my friends wanting to support and wanting to share stories about her. But I knew because of what we're talking about today, we just need a break.
Can I just say condolences on the loss of your mother? That's got to be, I mean, that's tough at the best of times, and these are not the best of times. How old was she?
54.
Oh my God. I'm really sorry. I'm really sorry. That's way, way, way too young. I know another family who also lost their mother in the midst of all this, and they tried to postpone having the funeral in hopes that waiting a little while might help and enable them to have more people get together to grieve. And the reality is we're still in the third wave, and so the funeral goes on with even a very diminished number of people attending to it. Lisa, what does, I don't know, give us your best advice on that kind of thing.
Yeah.
These are really very tricky personal circumstances to get through. And sounds like Bailey's advice about just getting off social media for a whole week may be the way to go. What do you say?
Yeah, I think our body, our brain, grief lives in both places. And what Bailey was saying, going on and just having to feel that over and over and over again, it's a lot. And it's very heavy. And so when we're dealing with that, we have rituals, we have mourning, we have funerals, all of these things for a reason, because it gives us that constructed space to remember, to connect, to feel. And I would encourage, I know in absence of a funeral or however you would normally celebrate a life, it's really hard to figure out what you need, but finding some ritual, some way to mourn is really important. And it might be a smaller version than you would hope moving forward, and you can still do that. But we really do need to acknowledge that. And then just as far as the feelings that are coming up, absolutely take a break from social media. You don't know, it's a minefield out there. What's going to show up as you're scrolling through? And grief is cumulative, right? There's cumulative grief. So we have our own personal experiences, and then we're reading about other people's experiences, and that triggers a similar response. So it's not like we can compartmentalize those things from a mental well-being perspective. And I do think we often want to pathologize grief because it feels so terrible and so heavy, but remembering and reminding yourself this is a really normal human process. And unfortunately, we do like to try to make it fit into a box because it is messy and it is uncomfortable. And we have certain models out there, and the narrative has often been there are certain right ways and wrong ways to grieve. But I think the best thing you can remind yourself of is this is really hard. I can feel hard feelings. I can move through this. And there's no right or wrong way to do it. And especially in this world now, all bets are off, so to speak. So figuring out what you need is going to be the most important, and recognizing that your process is going to look really different. And I would encourage even stepping away sometimes from some of the grief-focused social media like accounts out there that speak to grief education, because you just don't know if what they're saying is going to fit for you. And so being really cautious of what your individual experience is.
Bailey, what are you hearing or seeing out there about what can happen to people when they overconsume social media and overindulge in their grief, if I can put it that way?
Yeah, well, I define social media as a risky behavior like sex or drugs or alcohol. And Lisa will know this well. A risky behavior is simply something where when you participate, you expose yourself to potential harm, like drinking. And do I still have a glass of wine? Yes, I do. But have I learned how to do it safely and not use it as an unsustainable coping strategy? I've also done that. And so what's happening with social media is I'm still out there teaching people, hey, this is a risky behavior. I'm still in that conversation, saying when you participate, you expose yourself to potential anxiety, stress, traumatic imagery, and therefore PTSD, which is really on the rise this year, especially with race issues. So this is compounded for Black people, Indigenous people, and other people of color. And as Lisa said, grief is compounded. So now we've got the sort of social issues, the intersectional lens. You expose yourself to stress, lost productivity, fatigue. I mean, the list goes on and on of these risks. And so what happens is that if people are unaware of these risks, then they don't mitigate against the risks like they would with drinking, understanding how to do it safely. And so they just dive in. They're designed to be addictive. And by every measure right now, there is mass addiction to social media. And then without mitigating those risks, they enter into them almost without seeing it ever even happening. Suddenly I'm feeling depressed and I can't figure out why. And then they haven't made the connection yet. Oh, I just spent an hour on social media and I don't even remember what I looked at.
Lisa, I don't know if this question's even answerable, but let's give it a shot anyway, because I'm sure it's
Go
different
for
for
it.
everybody. But generally speaking, how much grief can the average person handle?
Right. The answer is there's no defined answer. It's very individual. What I will say is just remembering that we didn't walk into this experience as blank pages. We have carried our grief that existed even before COVID, and we will continue to carry that through. So recognizing this very, as Bailey said, compounding experience of grief and being gentle with yourself is very important. And if you're wondering if your grief is too much, that's probably an indicator that it's time to find an outlet for it. Because grief becomes heavy and it becomes hard and it becomes too much when we're not processing it, when we're not giving those feelings and those thoughts the space that they need. So if I always say to people, they're like, when should I get professional help, or when is it too much for me to carry? Is that if you're asking me that question, I think it might be time to figure out what you need to do to process that. And it can be professional support through a grief counselor or a group. Groups are still running online. Or if you have a different way that works for you, there are many ways to process grief, and it doesn't have to be with professional support necessarily.
Lisa, let me do this follow-up with you because I wonder, when I talk to older adults, I hear this all the time. I'm sick and tired of burying my friends. They do say that, and that's one of the downsides of getting older is that you lose more of your friends and companions. Having said that, does that give older people a greater resiliency and, frankly, more experience in how to wade through the minefield that is this subject we're discussing?
I think it depends on the person, because if we talk about, like, cumulative grief is not time bound, right? So if we talk about this idea that more years lived gives space for more grief experiences, that in and of itself can be quite a compounding factor. And if you're leaving grief unprocessed, it's not like, oh, the more immediate piece of grief is now taking precedence. It all exists together. And with that, some people in their older age are carrying a lot more. And what we know more and more with studies is we don't just carry that memory in our brain, we carry it in our body. And so it's a very interesting experience for older folks, because it might be that it's manifesting in more physical health ways, or more just more discomfort in their bodies as well. I think that if you've been through grief and you've had a lot of experience in processing it actively, because grief is not a passive process by any means, we need to work at it. We don't always naturally know how to grieve, or we block ourselves from naturally grieving because it feels terrible. So if they've had the opportunity to practice that, then probably, they're going to be more resilient. They're going to know what their coping skills are, and they're going to go to them quickly and easily. If it's been the experience where grief has been very hidden for them and they've had to kind of push it down, then I would argue that it might actually even be more magnified for them in this experience. And combined with the isolation and just the media, big long-term care homes and everything, that's a lot of specific information about older adults and scary information.
Mm-hmm. We just passed in the province of Ontario our 8,000th death last week due to COVID-19. And I want to ask the question about whether or not we're getting numb to the numbers. And to that end, Tony, I'm going to ask you if you would to bring this quote board up, and I'm going to read this. Talking to CTV News, Vardit Ravitsky, professor of bioethics at the University of Montreal and chair of the COVID-19 Impact Committee of the Trudeau Foundation, said, "If your friends and families are hit, then you're totally there with them. But when the number is 5,000, you lose the ability to put a face on it." She goes on to say, "We're already desensitized to the loss of human life that occurs far away from us, but this is happening here. This is our neighbors. So it's sort of like a new level of being desensitized." Bailey, can you pick up on that? Are people, do you think, becoming numb to the fact that there are people, even their loved ones, who are dying in numbers such that we are becoming desensitized to it?
I absolutely think that people, especially over the last 10 years since social media has become ubiquitous, have become more desensitized to trauma of all kinds. And I love what they've said there, highlighting the difference between that trauma or what we're seeing being so far away. It's almost like I can rationalize in my head a few years ago that, oh, that's on the other side of the world. But now it's happening right beside us. But still, that doesn't change the fact that our brain, like as was said, cannot really justify or understand big numbers to that degree. We can calculate them, but when we're talking about crowds, for example, our brain, not much difference in our brain between 100,000 and 200,000 when we're talking about a crowd. Not even that much difference between 1 million and 2 million in a crowd. And now we're talking about, it was 5,000, then 8,000. And I think that the number itself is not enough for people to really feel the impact of this unless you are personally affected. And I want to kind of follow up to something that Lisa and you were both saying earlier as well. Our brains are in a state of our brains are trying to keep us psychologically safe. So it's only when these threats or these stressors come that it kind of has to notice. So we're actually primed to notice all of these negative stories. I think that contributes to the doom scrolling. It contributes to how we're interpreting the news about COVID. It makes us feel like, okay, in order to be safe, I need to know about the threats. And then because of the negativity bias of our brain as well, not only do we scan for the negative information, it's stored in our long-term brain much quicker. So we see news like 8,000 people have COVID and we're storing that, but that's not really being stored as much as the immediate threat of that one person who was at the store where I live that got COVID.
I've always wanted to ask grief counselors this, Lisa, so I'm going to ask you.
Go right
You
ahead.
got a hard job in the middle of a very hard time, and you hear a lot of misery out there. What kind of impact does that have on you?
It definitely has a tough impact. I must say that this last year, we've seen a huge increase at Andrea Warnick Consulting in the number of clients that are coming through. And as Bailey pointed out, there's the professional kind of, or the more distant experience of it. And then not only do I carry my professional lens, but obviously I carry part of myself into the work too. So it's really watching myself and what's being triggered within me and noticing what's happening in my body and everything like that. And obviously I didn't get into this work without some coping skills in place. So I've really doubled down on all of that and making sure that I'm finding a balance and in the number of clients that I'm seeing, and I'm processing what I'm hearing, visiting my own therapist on a regular basis. All of these things are so important to be able to hold the things that you're being told. And I think something that is also really important, not just in the work I do, but in what's happening in the world right now, is recognizing what is within my control. What can I do here for the person sitting in front of me telling me their story, or with these stories in the news, and what is not? And I'm not saying that we discount what is not in control. We just deal with it differently. So when things aren't in our control, we just need to process our feelings around that and let them exist and be an unbiased, unjudging observer of that, and recognizing that we can't control that. And then for the things that are in our control, reminding ourselves and really paying attention to that. So those are kind of the ways that I frame my work, and I think.
Right. Bailey, let me get you to react to something that I just heard Lisa say. And you know, it's an interesting expression, but I'm not sure everybody knows what it means. She said, I listen to my body. Maybe you could help us with that. What should we listen for in that case?
Sure. Yeah. It's funny because the other half of my life is that I own a soft skills training company where we teach things like mindfulness, resilience, stress management being overwhelmingly the most popular program over the last year across the world, by the way, our clients come from. And so when she's saying, listen to your body, it's more about being first mindful about what is going on in here, and have I ever even looked inwardly, and have I done a bit of self-awareness work and thought, what does stress me out, and how do I react to stress, and what's the outcome of that, and when that happens, how do I get through it? What are my coping strategies? And what I found over the last year is that a lot of folks maybe had their set coping strategies from before the pandemic, but they've never really thought inwardly or listened to their body and their mind about what can I do now? Because there might have been a lot of coping strategies like going out for a night with your girls, or going to see your friends and family, or hanging out and doing anything with other people that they can't use now. Even in the middle of the workday, people will say, I go to the water cooler, I go to the kitchen and I have a chat with my friend, and then I go back to work. And none of these coping strategies are available right now. So we have to listen to our mind and listen to our body right now and reassess what those are for us right now. And so I think that's a really great start. And if I may, as we get into, I love getting into the strategies about what we can actually do about this. Well, what I found in my research when I was talking to a lot of young women about how social media affects their mental health, the most important thing, absolutely bar none, the biggest indicator of whether they would have a good or bad experience on social media was their offline affect, otherwise known as their emotions, how they felt about themselves and their life at time of social media use. If they felt bad about themselves, they were much more likely to have a bad experience on social media, to do that doom scrolling, to take in that trauma. And if they felt good about themselves, overwhelmingly, they were much more likely to see the Instagram model and be inspired by her as opposed to compare themselves to her, or to see that imagery and think, you know what, I'm not going to do this right now because I was feeling good. So the most important thing is exactly what Lisa said, which is listening to your body and mind before you go use social media.
Some great advice from both of you tonight. We're really grateful. Lisa and Bailey, you could both join us here on TVO. Take good care and good luck in the days ahead.
You too.
Thank you.
And Bailey, I hope you get that wedding in under the wire at some point too.
Yeah.
Steve, same. I am ready to party again.
Good. We wish you well. And that is the agenda for Thursday, May the 6th, 2021. Ontario has its first poet laureate, and tomorrow he'll join Nam Kiwanuka for a conversation about what that means to him and what it could mean for the rest of us. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org. And Nam will be not exactly here, but she will see you tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.